that migrants who are coming in great numbers are not being tested for COVID at their first point of contact with Border Patrol?
Those who can't be expelled are often placed, and this is, I think, goes to your question, in alternatives to detention programs while their cases are being reviewed. CBP provides migrants with PPE from the moment they are taken into custody, and migrants are required to keep masks on at all times, including when they are transferred or in the process of being released. Our other protocol is if anyone exhibits signs of illness in CBP custody, they're referred to local health systems for appropriate testing, diagnosis, isolation, and treatment. That is our process.
Is President Obama setting the wrong example about how serious COVID-19 is by hosting a big birthday party with hundreds of people this week?
Well, I would certainly refer you to the team who is working for my former boss to give you more specifics of what the protocols are in place. But I would note first that former President Obama has been a huge advocate of individuals getting vaccinated.
But is there any concern, just because, as you said here, and you've had people saying over the last couple of days, vaccinated people can still spread this Delta variant around. So is there concern that this President Obama birthday party might become a super spreader event?
Well, I think, Peter, the guidance is about what steps people can take when they're in public settings. Indoor settings specifically was the new guidance to keep themselves and others safe.
People who are watching this at home and they see, well, President Obama can have a party with several hundred people. Should they think that it is okay for them to have a party with several hundred people now?
Well, we certainly advise everyone to follow public health guidelines, which I know the former president, who is a huge advocate of getting vaccinated, of following the guidance of public health experts, would certainly advocate for himself as well. Go ahead, Kelly.
Expect more guidelines coming out because of COVID, because of the Delta variant, and he said in all probability. So what's on the table?
I'm not, obviously the president is keeping the option open of making sure that he is, that the CDC and our public health officials can make recommendations on what's needed to keep the American people safe. I'm not in a position to preview that.
Inspector General announced today that they are opening an investigation into this large tent camp at Fort Bliss that houses migrant children because of reports that kids were having panic attacks and exhibiting self-harm. I'm wondering, have any changes been made already to address some of those concerns, and how big of a concern has this been for HHS and the White House?
Well, thank you for the question. Secretary Becerra did speak to this last week, and HHS does take every allegation of wrongdoing seriously and swiftly report allegations not only to the Office of the Inspector General, but to the appropriate local authorities.
The U.S. has now hit the president's July 4th goal to get 70% of American adults with one shot. What is his reaction to that goal being met a month late?
Well, it was a goal that he set. We set as an administration because we believe in bold, ambitious goals. I would say it's a significant step that we have hit 70% of people in this country, of adults who are vaccinated. That's a good sign. It will help protect.
Agencies are going to be paying the cost of testing for workers who choose not to get vaccinated. Does that mean taxpayers are going to be paying for the test of federal workers who choose not to get vaccinated?
I'm sure I can check with each agency. It may be different agency to agency, but it's typically would be a part of their funding. But I can check and see if there's more clarification on that front.
Lindsey has announced that he has tested positive for COVID after being vaccinated, and will be doing some self-isolating, which could have an impact on, for example, the bipartisan infrastructure. So what is your reaction to that? And secondly, does the administration feel like they need to get more sources of information on breakthrough cases, given the anecdotal experience many people are having of seeing more incidents of that, beyond just the issue of hospitalizations and deaths, but more information about how much the breakthrough cases are spreading?
Well, let me first say that every single piece of available evidence shows that breakthrough infections are rare and mild, and that is according to a range of data. We certainly do hope that Senator Graham has a speedy recovery and experiences mild symptoms, and we wish him the best of health through that. Okay.
Just the team that beat Michigan in the final.
Learning new things every day. Okay. Couple things for you all at the top. In addition, today the Department of Education released their Return to School roadmap of great interest to many parents, students, educators, and communities across the country. It outlines the community resources and support they need for a safe and healthy school year this fall. Thanks to the American Rescue Plan, every school has the resources they need to ensure every student can learn in person, which is absolutely remains our objective. The roadmap addresses 3 landmarks and provides strategies and resources to get communities there, including health and safety, vaccinations for Americans 12 and older, and indoor masking, social, emotional, and mental health support for students, and accelerating academic achievement. The president has been clear that it is a top priority to have children in school in person full-time this fall, and he has secured the resources to help ensure we can do that safely. I'll also note that I've invited Secretary Cardona to come join us in the briefing room this week, so we're working to schedule that as well to give you all a briefing and an update. I also wanted to note that with Congress on recess for most of August, we are launching a huge push throughout the month to promote President Biden's Build Back Better agenda and highlight the success of the president's first 6 months in office, especially in delivering economic relief to the American people, creating a record number of jobs for an administration's first 5 months, and spurring on the fastest economic growth during the first half of the year in almost 4 decades. In addition to a regular cadence of White House messaging to support the Build Back Better agenda, key principals, including the Vice President, the First Lady, the Second Gentleman, will fan out to hold events in communities across the country, touting the President's Build Back Better plan to drive more economic growth and invest in America's middle-class families by cutting taxes for families with children, lowering health care costs, and meeting the moment on climate change. The President will also promote his agenda throughout the month. They'll be joined in that effort by the Cabinet, which will be stumping in every corner of the country on the importance of passing both the bipartisan infrastructure bill, can we call it the BIB now? I'm going to try, and the Build Back Better agenda to invest in our economy's strength, make life better for all families, and confront the existential challenge of climate change. As part of that, in the first 2 weeks of August alone, 14 Cabinet secretaries will travel to at least 26 cities in 13 states and the District of Columbia, with additional events being added. As just one example, Secretaries Walsh and Raimondo will be heading to New York City this Wednesday to highlight the broad support from both labor and business community for the president's economic vision. With that, Jonathan, kick us off.
Thank you. First, one follow-up to the evictions thing and then moving on to foreign policy. Quickly on this, from the briefing we just received, it seems like the White House does not want to challenge this in court. The lawmakers, Democratic lawmakers who are unhappy with the response so far are basically saying, and I'm paraphrasing, don't let Brett Kavanaugh stand in the way of this. Why not take executive action now to direct the CDC and deal with the court later on?
Well, I think what you should have taken from the statement that was put out right before the briefing, and also Jean joining us in the briefing today, is that the president has not given up the option of legal action. He has asked his team to look to kick the tires, just to keep the analogy going, and look at every authority, every option we have to keep more people in their homes. That is his objective. At the same time, he's also focused on the policy options that are at play, whether it's encouraging states to use funding, to get the funding out, to extend the moratorium by 30 days, 60 days in some states that can keep people in their homes, and to see what other policy options we have at our disposal. So we are using every tool we can. We are still kicking looking at legal authorities to see what is possible, but he's not going to take a step without legal authority to do so.
How much more time is he going to kick the tires?
Well, it's clearly a priority to the president, given the extensive statement we put out this afternoon. He was laser focused on this all weekend, I can confirm for you, and has been from the beginning of the administration. I mean, as a reminder, I know Jean touched on this, but he wanted to see an extension in January in the American Rescue Plan. It obviously wasn't in there. The CDC extended the moratorium not once, but 3 times. We made clear when we did the last extension that would likely be the last extension because of the legal limitations. But he's going to keep pushing to see what the options are available to him and if there are any additional options available.
And then the foreign policy matter. Now that the United States, per the Secretary of State's statement yesterday, agrees with Israel and the UK that Iran was behind the attack against the ship, would the U.S. support an Israeli retaliatory strike on Iran? And how does this matter impact at all the U.S. position in the indirect nuclear talks if they restart?
Well, as a sovereign country, Israel is going to make their own decisions. But I will say that as it relates to our own engagement in nuclear talks, which we, of course, do have authorities over, or do have decisions to make there, our view is that every single challenge and threat we face from Iran would be made more pronounced and dangerous by an unconstrained nuclear program. So put another way, constraining Iran's nuclear program by returning to the JCPOA will put us in a better position to address these other problems. It doesn't mean that it will take care of the other issues that have been ongoing concerns we've had with Iran. They are a bad actor on the global stage. They have threatened our own military, as we all know. But we continue to believe that pursuing a diplomatic path forward, that pursuing an opportunity to make sure we have greater visibility and into what their nuclear capabilities are is in our national interest. Go ahead.
Hey, just quickly, on Friday, the president was asked whether Americans should expect more guidelines coming out because of COVID, because of the Delta variant, and he said, in all probability. So what's on the table?
I'm not. Obviously, the president is keeping the option open of making sure that that the CDC and our public health officials can make recommendations on what's needed to keep the American people safe. I'm not in a position to preview that or to get ahead of any decisions they may make. What I can reiterate, though, is, and you heard Dr. Fauci and Dr. Collins reiterate this weekend, we've been clear we're not going back to the shutdowns of March of 2020. We are not going back to the economy shutting down. We've made too much progress. Too many people are vaccinated. There's been too much progress on the economic front. But again, he has said from the beginning that we are going to be guided by the science, guided by our public health experts, and we're not going to take options off the table of what they may recommend.
And then just on Israel, but different topic, the NIH director says he doesn't see a need for booster shots, yet we're seeing this model out of Israel suggesting that boosters are beneficial. So is Israel ahead of the curve on this one?
Well, if you're referring to the Israel data from a couple of weeks ago, is that the data? Mm-hmm. Which was not fully extensive and fully published at the time. I'm not sure if there have been additional details since then. Our health experts continue to look at whether there would be a need for boosters. I would remind you, too, we have, from the beginning, planned for a range of contingencies as we have purchased supply of vaccines, just in case there are boosters needed. There hasn't been a decision made by our public health experts that it is needed even for a portion of the population. If that decision is needed, we will be prepared as a government. Go ahead.
Jen, also following up last week, President Biden was asked about the Justice Department or additional things that can be done for vaccine mandates. And he said that the Justice Department was looking at that. He didn't have an answer yet. Can you elaborate what the Justice Department may be looking at or exploring in terms of mandating vaccines?
Well, I think Karine said this on Thursday or Friday, that a federal mandate from the federal government is not on the table. So I think what the president was referring to is the fact that employers can take that step, just as the federal government, and you've seen agencies do that, has the authority to take that step according to the OLC.
So he's not looking at it the way that the administration did with mask mandates, where it was mandated on federal property that you had to have a mask. There's not a similar exploration of doing vaccines that way to encourage more people to get the vaccine.
Not across the country, no.
Okay. And just to be clear, can vaccinated people be indoors with other vaccinated people? I mean, is that okay for people to be doing?
I know Dr. Collins spoke to this during one of his interviews this weekend, and the good news is there is a COVID briefing coming up this afternoon where you can ask questions of our public health experts, but they've not changed that guidance in the guidance from last week. They updated guidance on masks, but I certainly would encourage you to ask them that during the briefing. Go ahead.
Thanks, Jen. Back to the eviction. Several states, including New York and Florida, have been slow to disperse available federal aid to landlords and renters. In Florida, some 2% of available funding has been dispersed. So I'm wondering, has the White House been in touch with Governor DeSantis, for instance, and other state leaders to see what the holdup is, and what do those discussions look like?
We certainly, I can't speak to any contact specifically with Governor DeSantis about this, but we have been in touch with state authorities and localities about what the holdup is or what the delay is in getting this funding out. And as Jean conveyed very clearly, 1.5 billion was distributed in June. That was faster. That was greater than the 5 months prior or the 4 months prior. That's a good step. It's not nearly enough. And certainly getting the additional funding out there will help keep more people in their homes, which is our goal, which is Speaker Pelosi's goal. So absolutely, we're in touch with local housing authorities and leaders in states to ensure they're moving this ball forward.
And then in light of the ACLU's decision to go back to court over Title 42 and push the administration to roll that back, does the president view it as a Trump-era restriction that he just needs more time to unwind? Or after roughly 6 months of using it, does he now view it as a necessary tool to maintain control of the border?
Neither. The president views it as a public health measure where the CDC is going to continue to provide guidance on how long it needs to be in place. We have not given a timeline of when they will lift Title 42, but we will look for them to provide us that guidance. Go ahead.
And about public health at the border, is the president concerned that migrants who are coming in great numbers are not being tested for COVID at their first point of contact with Border Patrol?
Well, let me give you a little bit of an understanding of what actually happens when people come across the border. First, as to Katie's earlier question, there's been no change in Title 42, so families and single adults are expelled, if possible, when apprehended at the southern border. That's step one. Those who can't be expelled are often placed, and this, I think, goes to your question, in alternatives to detention programs while their cases are being reviewed. CBP provides migrants with PPE from the moment they are taken into custody, and migrants are required to keep masks on at all times, including when they are transferred or in the process of being released. Our other protocol is if anyone exhibits signs of illness in CBP custody, they're referred to local health systems for appropriate testing, diagnosis, isolation, and treatment. That is our process.
Okay, and then just about COVID safety, is President Obama setting the wrong example about how serious COVID-19 is by hosting a big birthday party with hundreds of people this week?
Well, I would certainly refer you to the team who is working for my former boss to give you more specifics of what the protocols are in place. But I would note first that former President Obama has been a huge advocate of individuals getting vaccinated. When CDC has provided guidance on is for indoor settings in high or substantial high zones of COVID cases. This event, according to all the public reporting, is outdoors and in a moderate zone. But in addition, there is testing requirements and other steps they are taking, which I'm sure they can outline for you in more detail.
But is there any concern, just because, as you said here, and you've had people saying over the last couple of days, vaccinated people can still spread this Delta variant around. So is there concern that this President Obama birthday party might become a super spreader event?
Well, I think, Peter, the guidance is about what steps people can take when they're in public settings. Indoor settings specifically was the new guidance to keep themselves and others safe. In terms of what protocols they are taking, I would refer you to them, and I'm sure they can give you more details.
And just last one. So people who are watching this at home and they see, well, President Obama can have a party with several hundred people. Should they think that it is okay for them to have a party with several hundred people now?
Well, we certainly advise everyone to follow public health guidelines, which I know the former president, who is a huge advocate of getting vaccinated, of following the guidance of public health experts, would certainly advocate for himself as well. Go ahead, Kelly.
Senator Lindsey has announced that he has tested positive for COVID after being vaccinated and will be doing some self-isolating, which could have an impact on, for example, the bipartisan infrastructure. So what is your reaction to that? And secondly, does the administration feel like they need to get more sources of information on breakthrough cases, given the anecdotal experience many people are having of seeing more incidents of that, beyond just the issue of hospitalizations and deaths, but more information about how much the breakthrough cases are spreading?
Well, let me first say that every single piece of available evidence shows that breakthrough infections are rare and mild, and that is according to a range of data. So according to new research from Kaiser Family Foundation from January to July, the rate of breakthrough cases reported to states is below 1%. We've seen data come out from England, Scotland, Canada, and Israel showing that vaccines are about 80% effective in preventing illness from Delta and about 90% effective in preventing hospitalizations by Delta. CDC is actively tracking tens of thousands of people in cohort studies, as I think you know, and we've talked about a little bit in here. Some of them doing weekly PCR testing, which includes healthcare professionals, first responders, hospitalized adults, and people in long-term care facilities. Also, states and hospital associations are reporting their own data. Now, we know there's an interest in getting that data. We support that. Dr. Walensky says that they plan to release that as well, which we, of course, support as well, and it's important for you all to look at. But I would note that, and I thought this was important because if you look at the power of vaccinations, you're looking at specifically the numbers of, according to 7-day averages of January versus July. January is, of course, the lighter numbers, and then the darker number is July. And if you look at hospital admissions and deaths, this is really because of the impact of the vaccine and how effective it is at preventing people from being hospitalized and dying from COVID. We certainly do hope that Senator Graham has a speedy recovery and experiences mild symptoms, and we wish him the best of health through that.
In places like Florida, where hospitalizations are at a record level, is there any concern about the number of resources available, rationing of care, additional equipment that needs to be sent in, or personnel to assist?
Well, one, we stand ready and available to provide any assistance that is needed, whether that is Florida or any other part of the country. We've done these strike forces. We are at a very different point in the pandemic than we were a couple of months ago. We have ample vaccine. We have ample experts. We have ample resources to provide them. I will note, as you touched on there, 20% of the cases we're seeing are in Florida. There are steps and precautions that can be taken, including encouraging people to get vaccinated, encouraging people to wear masks, including allowing schools to mandate masks and allowing kids to wear masks, which is not the current state of play in Florida. So, at a certain point, leaders are going to have to choose whether they're going to follow public health guidelines or they're going to follow politics. And we certainly encourage all governors to follow the public health guidelines. Go ahead.
Thanks, Jen. As you know, the UK and EU are now reopening to vaccinated travelers from the US. Can you give us an update on the decision-making process here in the US about whether and when to reciprocate?
Certainly understand the question. I know there's a lot of people out there who are eager to see loved ones, to travel, to return to flights between our country and many countries in Europe. I don't have an update. There's ongoing discussions on a policy level with public health officials. As you know, we have these ongoing working groups, but I don't have an update on the timeline of a decision.
And then the HHS Inspector General announced today that they are opening an investigation into this large tent camp at Fort Bliss that houses migrant children because of reports that kids were having panic attacks and exhibiting self-harm. I'm wondering, have any changes been made already to address some of those concerns, and how big of a concern has this been for HHS and the White House?
Well, thank you for the question. Secretary Becerra did speak to this last week, and HHS does take every allegation of wrongdoing seriously and swiftly report allegations not only to the Office of the Inspector General, but to the appropriate local authorities. I would say that there have been actions that some of the reports of conditions are several weeks old or even longer than that, and so there have been steps that have been taken to make improvements on the ground, including children at Fort Bliss meet with a case manager on a weekly basis, and we have close to 60 mental health and behavioral counselors on site working with the children. One of the issues that was raised was the lack of mental health access, so that's a step the HHS team has worked to improve. More than 1,000 staff at the OR at Fort Bliss have received required training, including child best welfare practices, behavior management, trauma-informed care, cultural competence, and reporting. Training is ongoing as well, and this is certainly an issue we take quite seriously. These reports were made directly to the Office of the Inspector General, and improvements have been made.
We're told you have a hard out, so maybe like two more.
Okay, go ahead.
Thank you, Jen. A couple of quick questions. One on vaccine misinformation. Since President Biden and the Surgeon General, have spoken about the issue, you've spoken about it as well. Has the White House seen the companies, specifically Facebook and the other social media companies, take any steps to address vaccine misinformation? Any notable changes that you have seen?
It's a really great question. I will have to talk to our team and see if there's any specific notes of improvement that we can call out. I'm happy to do that or connect you with them directly.
So the reason I ask is obviously because we're seeing this increase in vaccinations again, and that seems to be tied to the number of cases going up. But we're just sort of wondering if there is anything that we can tie back to maybe some of the misinformation campaigns being contained.
Well, look, I think that it's hard to draw a connection to one specific step in any local community. But there's no question, you see this anecdotally through a lot of your reporting, which is where people see their neighbor got a vaccine, their friends got a vaccine, and they're okay. And on the flip side of it, they had a friend or a neighbor who was hospitalized, and it made them go and get a vaccine. So certainly, it's an ongoing battle against misinformation. It's not just on Facebook, though that is a mechanism for misinformation traveling, no question. It is through a range of mediums. We all have a responsibility, but we are certainly seeing in the states where there are higher case rates, we've seen record rates of, I should say, very encouraging rates of vaccination, and that can be because of a number of factors. Go ahead.
Sorry, I just had one more on voting rights quickly.
Sure.
There are 100 state legislators who are converging in D.C. today from over 20 states. They're going to be meeting with Texas Democrats. We did see the vice president meet with Texas Democrats earlier. I just was curious if the president and the vice president plan to meet with these lawmakers and if they have any message for them.
Well, first, I would say the president and vice president, the message to them is we stand with you and believe that voting rights are a fundamental right for the American people across the country. And the president would love to sign voting rights legislation into law. This will continue to be a fight of his presidency, and that's why he's asked the vice president to lead this effort. Go ahead.
Two quick ones for you. The U.S. has now hit the president's July 4th goal to get 70% of American adults with one shot. What is his reaction to that goal being that a month late?
Well, it was a goal that he set. We set as an administration because we believe in bold, ambitious goals. I would say it's a significant step that we have hit 70% of people in this country, of adults who are vaccinated. That's a good sign. It will help protect communities. It will help protect families and save more lives. But we've said from the beginning, even when we set this goal, our work would not be done, even when we reached it. And so we're forging ahead.
And I want to follow up on something from Friday, which is that was said on Friday. Agencies are going to be paying the cost of testing for workers who choose not to get vaccinated. Does that mean taxpayers are going to be paying for the test of federal workers who choose not to get vaccinated?
I'm sure I can check with each agency. It may be different agency to agency, but it's typically would be a part of their funding. But I can check and see if there's more clarification on that front. I know we have to wrap, but Mona, I know you came in and came out, so why don't you end us off here?
I appreciate it, Jen. A couple of things. I want to follow up. I was asking the president on Friday before his departure, why hasn't he, I have an inkling, but for the American people, why hasn't he signed an executive order on the VRA? That's the one thing. And then to follow up on the eviction moratorium for context, there, of course, you probably know there is landlord state, renter state type of situations. And so in the state of Florida, it is a landlord state, meaning the law favors landlords. Some of my research has indicated that renters are having a difficult time in a general sense, and now that they have these tools that they can take advantage of from the government, they are facing more stress and a lack of cooperation from these landlords. I've gotten a lot of that over this past week. I have been following this since a month or so ago, reporting on this weekly. And what I'm hearing more and more is that people are afraid that they're just not going to get the support because of that lack of cooperation. And I know it's been addressed, but what do you think we can do, or the government can do even further to make sure that these states and local municipalities are cooperating?
Well, Mona, I think one thing that's really important is to make sure that communities understand best practices and that they know how to get this funding out. As Jean touched on, there's unfortunately a dispersed system across the country on how to distribute this funding to renters. It's not just, the issues in the housing market or keeping renters in their homes is not a new issue. It's one that has existed for quite some time, as it sounds like you know well. So One of the things we've done is we've hosted these 2 summits with 46 of the cities, with most tenants at risk, to help jurisdictions set up these new eviction prevention programs. And certainly we want to provide renters with the understanding of what their rights are in this regard, that this funding can go out until 2025, that this funding is something that the federal government has advocated for, because we want people to stay in their homes. There's no question there's more work to be done, but the president advocated for this because he wants to make sure more people can stay in their homes. And you were acting about the
DRA, just principally, people want to know if the president can sign an executive order for transgender rights, for example. Why can't he find the same power? Does he have the same power to sign an executive order for the VRA?
Well, the Voting Rights Act. First of all, I would say that in order to make change permanent, you need legislation and you need laws passed. And the president is looking forward to and eager to sign voting rights legislation into law. There have been ongoing discussions, many of you have reported on, and he's going to keep at it. He did sign a voting rights executive order early on in the administration, a historic voting rights executive order, which he wanted to tap into every authority he had from the federal government to protect people's rights, but certainly making laws permanent will protect them longer term. I know we'll have a longer briefing tomorrow. Thanks so much, everyone, for your time.